Cameraman 1.
2,
3, 4, 5, 6. Hi, my name is Renee, and today I'm going to show you how you would stay alive if you were to lose kidney function. If you have diabetes or high blood pressure, you are at a higher risk for losing your kidney function. Your kidneys serve three main functions. They help to keep your electrolytes in balance, they help remove excess waste and fluid from your blood, and they help to make red blood cells. If your kidneys have failed, you must go on a treatment called dialysis. Dialysis has been around since 1943. According to the core curriculum for the technician, a Dutch doctor in 1943 invented the first dialysis machine. As you can see from these pictures from the dialysismuseum.com, dialysis has come a long way since 1943. Now I will show you what a patient care technician must do in order to get ready for a treatment for their patient. The first thing we have to do is set up our dialysis machine. You're going to need a bag of saline, a dialyzer, which is the artificial kidney, and your blood lines. You want to start with the arterial blood lines, which is the red ones. You have the red on the machine and the blue. So you're going to start by stringing your arterial lines. You want to put the chamber in the chamber holder, open your blood pump door, and you're going to feed your blood line around the pump. Push the start button and the blood line will automatically feed around the pump. Shut your door. You have your dialyzer line just connected to the dialyzer holder, and then clamp all your little white clamps. Now you're going to have a big red clamp. This is your patient connector. You want to put this one in the drip container. The next step is to spike your saline bag. Your saline is going to run through your lines and push out all the air, because if a patient gets any air, it could cause death. So while that is priming our arterial line, we're going to string our venous lines. Put your venous connector in the chamber, and again clamp all your small white clamps. Your venous dialyzer line can go on the dialyzer clamp, and then you have a venous patient clamp, which is the big blue one. Put that one in the drip container as well. Once all the air is pushed out the arterial side, you can clamp the arterial patient connector. You need to fill your chambers by just unclamping the small ones, and your arterial chamber fills up. Then you have to prime your lines to your dialyzer. You can turn your pump all the way up, and then press start and prime in order to prime your dialyzer line. After that is primed, you connect it to your dialyzer and put the venous line to your dialyzer and turn your pump down to 150, and it usually takes about a minute and a half for it to prime through the machine and get all the air out. After it's done priming, it must go through a mandatory test. You cannot put your patient on unless the machine has passed all tests. And this is what your machine's going to look like after it's passed test. So the next thing we would do is connect our transducers. The transducer monitors the pressure in your chambers. Also, we must check the water coming from the back of the machine to the dialyzer. How you check your water is with a Phoenix meter. Your water has to be in a certain range before you can put your patient on. So once we know our water is in a certain range, we're going to connect our Hansen to our dialyzer. The red to the red, and the blue to the blue. Now the final test that we have to do is recirculate the machine for 3 minutes. This is our final test to make sure all the air is out of the machine. Once that is complete, then we're ready to call our patient back and hook them up to the machine. When the patient is back, we have to stick our patient with 2 needles. They have an access called a fistula, where we take the vein and the artery and the surgeon will tie it together, and we stick the venous and the arterial. The arterial needle is going to pull the blood from our patient and run it through a machine in a continuous circle through the dialyzer where the blood gets cleaned, and the venous needle is going to push the blood back to our patient. Now, a visual of the finished product of the dialysis machine with the patient on it looks like that. Now, a normal patient would have to run 3 times a week, either Monday, Wednesday, or Friday, or Tuesday, Thursday, and Saturday. They usually run for 3 to 4 hours a day. There are two big main corporations, either DaVita or Fresenius, and together they house over 200,000 patients together. So I highly recommend, if you don't want to have to go through a dialysis treatment, you need to take your blood pressure medicine as recommended by your doctor and control your diabetes and exercise and eat healthy. Now, are there any questions?
How do you clean the machines from patients?
We have to put, after the patient is done, we tear all the lines down, and then we have a bleach solution that we wipe the machine down with, and once a week we have to put the machine through a bleach rinse.
What are the kinds of symptoms of the patient needs to go on dialysis?
They can be nausea, or have fatigue, or uremia, where the toxins build up in the body.
What do you do if the machine does not pass the test?
If the machine doesn't pass the test, you can retest it, or we have backup machines that we can pull out.